My name is Tippy Irwin. I am the Director of Ombudsman Services of San Mateo County. It's a non-profit organization that provides advocacy to seniors in long-term care facilities. It's basically a volunteer organization. We have 6 staff and about 50 volunteers that work in the program. We monitor facilities for quality of care, quality of life, violation of residents' rights. And we respond to complaints from the residents. So residents have a problem, they can bring it to us, and we can work to resolve the problem. When the weather gets really hot, and we don't have a whole lot of hot days in the Bay Area, but when the weather gets really hot and humid, so many of our facilities do not have air conditioning. And our concerns at that time are that the residents need dehydration and cooling. They need to be kept cool. They need to be at temperatures that are reasonable. So on hot days, we know to get out and to go to all those facilities that we have concerns about. And on one occasion, a field ombudsman encountered a very obese woman in a small 6-bed facility in a back room, lying on the bed, too exhausted to even speak to the ombudsman. And the ombudsman was very alarmed. The woman's skin was clammy. She was in a cold sweat. She was feeling nauseous. The ombudsman actually insisted that the facility call the ambulance. She was taken to the hospital and found to be under extreme duress from heat exhaustion. Had we not done what we had done, had we not stepped in at that point, the woman could quite well have died as a result of her obesity for a start, but of what was happening to her body with the heat. So that's an example of some of the things we do and the critical nature of the work we do. Very critical, some of it. The volunteer ombudsmen are an extraordinary group of people. Some of them have been professionals in their former lives. Some of them are housewives, and have never worked out in the community a day in their lives. But they all come to us with some commonality. They are all very compassionate. They care about the aging population. They're committed. They'll follow through when given instructions to do something. They'll follow through. They go through a very intensive training program, 40 hours of training, and then when we feel that the individual is ready, and when they feel they're ready, they are then assigned to facilities to monitor the facilities on their own. But it takes a certain commitment to do that. So we look for people with a big heart and who want to give back to the community in a very meaningful way. We are always looking for individuals who are interested in becoming ombudsmen. And even if you'd like to become involved in the program in other ways, perhaps as a board member, or perhaps working on our emergency response team or our emergency planning team, working with us on tabling at health fairs, there are a number of ways you can get involved if you don't want to be an ombudsman, but our primary need is for ombudsmen. We really need individuals who are willing to go through the training and willing to work side by side with us as a team out in the community. All it takes is a commitment and a desire to give back.